Hi, and welcome to the June 2011 edition of Sex Talk, brought to you by UCSF Student Health and Counseling, where you get frank answers to your anonymous questions about sex. If you have a question that you would like answered, visit our website at studenthealth.ucsf.edu/sex. Today's first question is, are recurring yeast infections in any way associated with the presence of an IUD?
Hi, this is Lisa DiGiorgio-Haig answering your anonymous questions about sex. So as far as recurring yeast infections in the presence of an IUD, I actually researched this question and I could not find anything in the medical literature that speaks to this. However, I did do an extensive internet search, and as we all know, there's lots of information out there on the internet. It is important to remember that everyone has their own biochemistry, and although this isn't reported in the literature, it could certainly happen. And if you think you have any type of infection, you should see a healthcare provider to confirm that it's actually yeast, particularly if you have an IUD, because it's especially important that you don't want to go on with an STD that could be undiagnosed.
Our second question is, my girlfriend and I have been together for several years and have a great sex life. The only concern I have is that her vagina does not smell particularly arousing, which does not get me excited to perform oral sex on her. Why is this? She showers and cleans. And what is something that I or we can do about this? I have not had the courage to discuss this matter with her personally, since I don't want to offend her by speaking badly.
This was a very interesting question, and I wanted to give the person who sent it in positive reinforcement for not wanting to hurt his or her partner's feelings. And it's true, it's a sticky situation and it's somewhat complicated, but I'll try to address the many issues this involves. Now, one of the frustrations with Sex Talk is I just get a printed question and I don't get to ask more questions. In this case, I immediately thought, has this happened with other partners, or is this a first experience of having sex with someone? And it might just be an issue, if that were the case, of that it takes some getting used to. In other words, it's an acquired taste. Having vaginal scent is normal, and it's not really considered a problem in itself. However, if a woman or her partner notices that her normal scent suddenly changes or has become much stronger or seems fishy or foul, it may be an indication of an infection or another medical problem. In that case, you do need to talk to your partner. So if this was a situation that was fine and then something developed and your partner hasn't mentioned to you that she's noticed an odor, I think it's fair to say to your partner, I'm noticing something that I didn't notice before, and encourage her to get checked out by a healthcare provider. Troublesome vaginal odor can be caused by several factors. The most common cause is a vaginal bacterial overgrowth known as bacterial vaginosis, and this has a fishy odor. It can also be caused by other vaginal infections like trich, or in some cases from semen in the vagina. And as I said before, a physical exam by a healthcare provider can determine whether the vaginal odor is being caused by something that's treatable with medication, and usually, if that's the case, the unpleasant smell will go away after the treatment. And the physical exam can also detect other problems that might be causing unusual body odors. Okay, some basic steps to prevent run-of-the-mill vaginal odor caused by overgrowth of normal skin bacteria are to wash with warm water and unscented gentle soap. I like Dove unscented. Wear underwear and exercise clothes made from materials that breathe, such as cotton. Wear loose pajama bottoms or a nightgown or nothing at all to let your vagina breathe at night, and don't douche. There can be a link to perspiration. It can be caused by excessive sweating, which is a condition called hyperhidrosis. And if that's the situation, then your healthcare provider can take some measures to help you with that. If you've tried all these things and you're still convinced that it's not an infection, it's just the way your partner smells, perhaps including a shower together as part of foreplay might be nice. For example, if you've both been out all day, you might not be fresh as a daisy when you decide to have sex. Having the person giving the oral pleasure suck on a mentholated cough drop or some ice can help the person receiving oral sex have better sensation and might be helpful in a situation where the odor's a little bit daunting. Trying a drizzle of chocolate or honey are good ways to sweeten the experience. As a rule, however, you want to be careful about using anything to alter the smell or taste of oral sex, and you don't want to get it into the vagina because it can change the pH of the vagina and cause problems. All flavors or smells should remain on the outer vulva and clitoris. Sugars, oils, or artificial chemicals inside the vagina, again, could disrupt the balance and can lead to vaginitis, including yeast infections. Each woman has her own unique aromatic and flavor signature. Hopefully you can explore some of these solutions to fix a distasteful or disodorous situation, both through using some new products and through honest, open communication, which we always encourage.
So our next question is, my current partner has squirting orgasms. Are all women capable of squirting orgasms? What is happening during a squirting orgasm? And what is the female ejaculate made out of?
In my research, I uncovered some interesting statistics. Although this is a huge range, I was able to find one study that said that 10 to 69% of women actually experience squirting orgasms. And I'm sure this varies depending on the definition that they use. So I don't think that's too meaningful, but it definitely happens. And I love this quote. Like Stonehenge, solar eclipses, and countless other wonders of nature, female ejaculation has provoked both awe and controversy. Basically, some women do experience squirting orgasms, for lack of a better word. The fluid in question is expelled from the urethra upon orgasm. Many researchers, women and their partners, believe that the phenomenon of female ejaculation was really just a loss of bladder control until the famous book, The G-Spot, by sex researcher and educator Beverly Whipple, Alice Lattice, and John Perry broke through the silence and embarrassment that surrounded female ejaculate, leading many to G-spot joy. The female cum is produced by the Skene's glands, which are located near a woman's urethra and are made of tissue that's similar in composition to a man's prostate. This would seem to indicate that the woman's ejaculation is similar in composition to semen, without the sperm, of course. It is not pee. It's generally clear and somewhat milky, nearly odorless, and maybe a little sweet. Although modern science doesn't know exactly what female ejaculation is, women who experience it seem to have intense orgasms. And as a little tutorial, I'm going to read from a website that I discovered that tells you how to find your G-spot for any adventuresome couples out there who are interested in this, trying to have this experience. With a woman who's lying on her back and has her legs spread apart, the G-spot can be located by putting your fingers inside of her between 10 and 2 o'clock, as if her vulva were the face of a clock, and 12 at the top. Move your fingers deeper inside and curl them back so that they are touching and pressing against the top of her vagina or the back door of the clitoris. The G-spot swells from the size of a dime to the size of a quarter and fills with fluid that is not urine or vaginal fluid, which spurts out of the urethra, not the vagina, when a woman orgasms. This doesn't happen in every woman, so don't kill yourself trying to make this happen. It's just a fun activity. It does happen for some, and you're lucky if it does.
So our final question today is, I am 21 years old and have never had sex. On my last physical, my doctor told me I should get a Pap Smear. I told her I was not sexually active, and she said it did not matter. I did not follow through. I am very embarrassed to ask more questions on this subject. Because I have not had sex and am not sexually active in any form, I wonder if I need to go through this very invasive procedure. I am afraid this procedure will compromise my virginity.
I have to say I felt really sad when I read this. Please don't use this as a reason not to see a healthcare provider. Just find one who will communicate with you and respect your feelings. We are here to provide you with information, not make decisions for you. The information about Pap Smear frequency is changing all the time, but I'm going to give you my opinion. If you're a virgin, meaning you haven't had vaginal intercourse, you probably don't need a Pap smear. And even if you do have a Pap smear, it's a medical procedure. It will not cause you to lose your virginity. Although the instruments used to collect the cervical cells may stretch or even tear your hymen, which is the thin tissue covering the vaginal opening, which is present in some women who've never had sex, you'll only lose your virginity once you've had sexual intercourse. The purpose of the Pap smear is to collect cells from your cervix, which is the lower end of your uterus. The cells collected in a Pap smear can detect if you have cervical cancer or suspicious cells that indicate you may be headed in that direction. In most cases, in the vast majority of cases, cervical cancer is caused by a sexually transmitted infection called human papillomavirus, or HPV. If you've never had any type of sexual intercourse, you're unlikely to have HPV. However, there are other risk factors for developing cervical cancer, such as family history and smoking. Now, different organizations recommend different frequency of cancer screening. The American Cancer Society recommends that all women have an initial Pap smear by the age of 21 or after they've been sexually active for 3 years, whichever comes first. The American College of Obstetricians and Gynecologists recommends that women begin having Pap smears at age 21, regardless of when they become sexually active. Here at Student Health Services, we usually don't encourage Pap smears on virgins, but we are happy to try if people would like to have one. There's something to be said for having the experience, especially if you're a healthcare provider and you're going to be doing this to other people. Certainly if people are virginal and they want to have a Pap smear, I recommend using tampons for 3 months and requesting a slim speculum so that the procedure is not that difficult. Really good recommendation if you are planning to have sex at some time, get the Gardasil vaccine. We do offer them here at Student Health. This is Lisa signing off for June Sex Talk. If you have any questions, please email us. It's anonymous. And if email's not the solution, there are many healthcare providers here who are happy to provide you with information.